Are you stuck in the same old routine at work? Do you find yourself hitting a creative wall, unable to see beyond your current perspective? It's time to break free and unlock the power of fresh perspectives. Hello, and this is David Guthrie back with another episode of Discover Fresh Perspectives. Today, we're going to get some fresh perspectives from Gary Collins. So welcome, Gary.
Thank you, David, and good morning to you. Happy to have this opportunity to talk to you about my new life story that began in 2010. But thanks so much for having me.
Well, since you introduced it, let's talk about how you got to your new story in 2010 and really started to make a difference. So tell me a little bit about what led up to that, Gary.
Well, I think that it's interesting to know that I spent about 30 years in the high-tech industry with a number of major companies. But in 1985, my life changed. I'd been traveling on the road with a Canadian startup company, and I was in the United States, and we had a board meeting the next morning. I was in Dallas. I flew home. I got in late, around 1:30. I lived in north of Toronto and in Unionville, which is part of Markham. So I had to get up early. We had a board meeting back then in 1985. We didn't have all the technology we have today. So I had to get up really early. The board meeting was at 8. I was responsible for giving an update on Western U.S. and our development there. Went down to the office. So I think I left around 5 o'clock in the morning. So I'd had about 2.5 hours sleep. I arrived at the office, did my report, sent it to the printer, went up and got it on the way back. I didn't get to my desk. I was about to sit down, and I had a seizure. And I fell and hit my head in the desk and had a seizure on the floor. And my assistant was there to see it and to witness it. And when I came to, they took me in a cab to the hospital at Mount Sinai. And so at that moment, I was then diagnosed, had 2 more seizures that morning when I arrived at Mount Sinai. So for the first time, it was discovered that I was epileptic. And epilepsy was a new word for me.
So, and Gary, I'm thinking that must have been quite a shock because, as I recall, you've always been incredibly healthy and athletic, and to get that diagnosis must have been a real shock to you.
It was a huge shock to me, and the first reaction was scary. The seizure was physically exhausting. I can't remember exactly, but I know how my body felt as I was having it and after I had it. And then that realization that, what happened to me? And then you go through, why me? And then there's a diagnosis of epilepsy. I knew very little about epilepsy. And so, and then surprisingly, David, what happened was I was embarrassed. I was embarrassed. I felt bad that I put people through this, that they had to see this experience. And then especially after seeing people's reaction, the next day when I returned to the office, it was really obvious that people thought something was wrong with me. And then scary again. I lost my license as a result of, I had to be put on new medication. So there were lots of adjustments to that. And then I began to think about, am I going to lose my job? I was traveling in the U.S. for all the Western United States. And so because I couldn't drive, if I was going to a city and I had to travel in and around the city, the company had to send someone with me.
Wow.
So that's added burden to the company. It was a small entrepreneurial venture. So, my boss had to come with me on multiple trips. And so additional costs, I was really scared that I was going to lose my job, had a young family. And so I was really nervous. So my counter reaction, and as you just stated, was I wasn't going to let epilepsy beat me. I had to learn what it was all about. And I said, I'm going to overcome this thing. I stopped all consumption of alcohol. So May 31st, 1985 was the last time I ever had a drink of alcohol. My doctor and neurologist said it was a bad mix between my having seizures, possibility of seizures, and my medication. So instantly I stopped.
So just to be clear, Gary, we can still be friends.
We can be. Yes. Yes, we can. But interesting enough, David, has led to through my lifetime being excluded. The boys wanted to get together on a Friday night for a beer. Because I didn't drink, I was excluded from those opportunities. Um, and yet, I remember having conversations with some of my friends saying, "Hey, I'd still like to get together. I understand you guys are drinking. I have no problem with you drinking. I used to drink myself." But they felt self-conscious that they were going to have beer and they could get, tipsy or whatever, and the conversation might lead somewhere else. But lots of times I was excluded, so I felt different. I felt like, okay, my condition was having a factor on my relationships. So
And
I
sorry,
went
Gary. Sorry, Gary. I'll keep interrupting because it's my podcast. No.
great.
So I'm just wondering if on their part, if there is some concern that you might end up having another episode and they not know how to do it. Like I wonder how much was uncomfort or discomfort, or how much was fear. I guess there's no way to know, but I can imagine being a little bit of both, perhaps.
They're very insightful for you to say that because people were worried, always worried that I was going to have a seizure on their watch. And you're right. They didn't want to verbalize it. They didn't want to say, "Hey, I don't know how to take care of you." But a few people would say, "Well, what do I do if something happens?" And so, I'd go through the explanation. And there's all kinds of misconceptions in the marketplace today, like put a pencil or put something in someone's mouth. No, those things don't solve anything. So I'd have to say to people, here's what you do. And I explain it. And usually after the seizure you come to, you don't know where you are. You don't know what the date is. And it's really kind of coaching me back. It takes about 5 minutes to recover. And you lose that mental time.
Wow.
It's gone. So it's a little bit scary to know that, hey, there's something got chopped off and I don't know where I am. So anyway, the other part of me went into, okay, I'm not going to tell anybody, other than my family and really close friends. I didn't tell anyone for 25 years. I was
Wow.
afraid that companies would think that didn't have the right skill set, that there was an issue with me. I couldn't have responsibility. Part of the onset of seizures is stress. I lived in the high tech industry. There was incredible stress. I ran McAfee Canada for 6 years, and it's huge stress in driving that revenue. So I didn't want others to know that there was any issue around capability. But I also did. I went on this journey of trying to do things like fitness, better eating, conserve energy, get plenty of sleep. But number one, my mantra was hide it. Don't talk about it. Don't let anybody know. And so and that was my experience. Excuse me. Until 2010. In 2010,
Well, sorry, Gary. I hate to keep interrupting. I'm just wondering about our listeners wondering things like, how common is epilepsy, and how common is the experience that others have had like you, that you wouldn't know that they have epilepsy because they don't want to talk about it? Like, do you have a sense of how many people, live with
yes,
epilepsy?
yes, and I was going to mention that in terms of when I got to the board. But interesting enough, if you have a broken arm, people can see it. If you have a neurological condition, people can't see it. So, I have empathy for people who get migraines. You know, People can't see that you have a headache. So if you can't visually see something, sometimes it's hard for people to have empathy or sympathy or really understand that. So anyway, I'll answer your question. But in 2010, I'd lost some key people in my life. Lost my mother, lost two close friends, and um, I wanted to do something. I wanted to give back. I'd had a relatively successful life, and I wanted to do something special. So I looked at cancer, I looked at heart and stroke, and then I looked in the mirror.
Hmm.
And interesting enough, looked in the mirror and said, "Hey, you have epilepsy. Why don't you do something with epilepsy?" So went online, looked at epilepsy. Epilepsy Canada came up. I sent an email to the chairman of the board with my resume, said I wanted to do something special. I got a call within 5 minutes, and the chairman said, "Hey, people like you don't put their hands up. We'd love to have you on our board." So I joined the board, and I was the first person to join the board who actually lived with epilepsy.
Wow.
The first
Wow.
person ever. Epilepsy Canada was established in 1967. So we're not talking about a couple of years. The first person ever to have epilepsy to join the board. And so what I learned when I joined the board was that 360,000 Canadians, 1 in 100, live with epilepsy. Of those numbers, 67% of those, like myself, um, um, their seizures are mostly controlled through medication. I use the word mostly because even though your meds control seizures, you can still have them.
Hmm.
So it could be stress, could be induced by other factors. It doesn't totally, it's not a cure. You're not cured. The medication simply prevents them from happening under most conditions, but you can still have them. So, for example, I've had three since 1985, all because of extraordinary events. But then I've always been religious about taking my medication. So, excuse me again. 33% of Canadians live with intractable or drug resistant epilepsy, which means they can have seizures at any time, one a day, 10 a day. I've met people that had 300 a month.
Wow. And can't be
So
controlled.
can't be controlled. So interesting
Wow.
enough. So for me, when I was diagnosed, I lost my license. I lost my license for a year until doctors could confirm that my seizures would be in control. And then you have to get used to being on a chemical on a daily basis. So they have to set the levels, all that kind of stuff. So you go through this sort of human guinea pig process of being, evaluated in terms of, the how much you had to have and weaning off and what are the side effects. But so for those 33%, 95% of those are suffer from depression because they've lost hope.
Hmm.
They can't drive, they can't work. Their life has really, their families are all adversely affected because, I know families who haven't been on a vacation for 35 years because they've got a son or daughter who has intractable epilepsy and they can't be left alone. So it has a really major impact. And the most surprising thing for me when I joined the board in 2010, my first meeting, one of the neurologists was talking about SUDEP. I said, what does SUDEP mean? And they said, sudden unexplained death from epilepsy.
Wow.
He sat back and said, you could die from epilepsy? And they said, yes. And so I never knew that. And so approximately 2.5% of those with intractable epilepsy
Okay.
will die from SUDEP. And if you look at it from the most simplest perspective, a seizure is nothing more than a short circuit in the brain. So if that short circuit hits your heart or your lung, it's instantaneous death. And you can't bring people back. There's no resuscitation. They're gone. And unfortunately, the average age for SUDEP is between 17 and 27. So could
Wow.
you imagine losing your son, daughter at just as they're beginning their life? So it was really impactful for me. So 9,000 Canadians this year will learn that word SUDEP and how tragic that is. So sitting in that board meeting, and suddenly I'm faced with all these new things, and I sat on the board, and within 6 months, I felt like I wasn't doing enough. I'm just not doing enough, and so I put a proposal to the board at the time. I had a management consulting company, and I put a proposal to the board saying, I'll dedicate 33% of my consulting time at a price point favorable to the organization, and I'll come in as the interim president. So 2011. I'm still the interim president today. 14 years later, I'm still running the organization. And over time, I've dedicated more time. So the last 4 years, I'm really in semi-retirement today, but been dedicating 50% of my time to the cause. And it's been wonderful. And what I discovered was how lucky I am. What a life. I've had a great life, and to look around at some of the people that I meet on a daily, weekly, monthly basis. One individual we know who's almost family, Alex. Alex lives in Owen Sound. He has intractable epilepsy. He and his wife are the most positive people I know. And Alex has about used to have about 15 seizures a month, and through changes in medication, he's now down to five. And Alec and his wife have three beautiful young girls. So they had a daughter, and then they had twins. And so they're all under the age of 5 years old. And it's a great life, but Alec still can't work. They built systems around them from terms of family to be always connected to Alec. And he was afraid to have children. He desperately wanted children, but was afraid to because of his condition. But the family and his wife have been wonderful in supporting and being, and so they're living a new, near normal life today.
And
But
Gary, is there any, sorry to keep interrupting, I'm very curious about this. So is there any indication that epilepsy is genetically transferred?
yeah, so all kinds of research, and Epilepsy Canada, our sole mandated Epilepsy Canada is to raise money for epilepsy research with an objective to finding new treatments and to finding cures for epilepsy. Most people see epilepsy as one thing, but there are actually 8 different types of epilepsy and 21 syndromes. So if we
Wow.
can solve some of those along the way, and there is one cure today, and it's called seizure surgery that's been perfected. And again, that applies to a very small population. And if the seizure comes from a central position in your brain, a focal point, and it can be identified by MRI technology, surgeons can go in and remove it, and now you are in fact seizure free.
Wow.
And it's remarkable. And again, it's been going on for about 10 years, but enhancements in technology in terms of finding that focal point, the new surgical methods are contribute to helping that. But that is one cure. But it's only affects about 1% of the 30%.
So you said there were 8 different types and different syndromes. Maybe just the level of what those 8 types are. Then I'm also curious about what some of the side effects are of some of the medication. But maybe if you could just describe the 8 different types, Gary.
Very difficult to do that, David.
Oh.
I could send audiences a list of the 21 syndromes, but I'm glad you asked about the side effects because this is also part of my story. I was on a drug called Dilantin, and it's one of the first epilepsy drugs. There are now, thankfully, 21 new medications in the marketplace. So research over time has been successful at finding new treatments. But over time, the side effects were beginning to really affect me and my health. About 6 or 7 years ago, I saw and felt end of life. I had,
Wow.
I was, my life was really not very good. I couldn't do sports anymore. My balance was off, and happened to have an opportunity that we had funded a neurologist at Toronto Western Hospital. He and I were in Sarnia, Ontario, doing a presentation at the Rotary Club. He's working on this great research that I had to talk about. And so the night before we got together, Peter knew me just from our work in epilepsy. We weren't close friends, but we know it. So he asked if he could ask a couple questions, and I said sure. So he asked me what medication I was on. I told him, and he said, "Can I ask you about your side effects?" Sure. So we get into 7, and I've failed all of them. But the most pressing one, then the one that scared me the most was he asked me about my mood swings. And I sat back and looked at Peter. I said, Peter, I don't know what's going on, what's happening with me, but I can go from happy to anger in a nanosecond, and I can't control it. After I've vented, I know that I've vented irrationally, and it's driving me crazy, driving my family crazy, driving people around me crazy. And he said, put down his fork. And he said, Gary, you have to get off that drug because it's killing you. Wow. I had felt it. And he said it's the accumulation over time of the side effects. It doesn't just happen day one. So you're not feeling it, but you're feeling it over a lifetime. And so I asked Peter if he could be my neurologist. He said he could if the board allowed it because he was funded by Epilepsy Canada. And the board simply wanted me to be healthy. So it's easy for me to abstain from voting any of the proposal from Peter. Went in to see Peter, and again, I failed all the tests. I had tremors in my hands, I had tremors in my eyes. My concentration was at risk. Um, the medication was causing my weight to increase. I'd lost all balance. I couldn't even golf because to swing could mean I could fall on the ground. Um, and so failed all the tests. Peter was a pretty funny guy. He sent me a note saying, I got good news and bad news. Good news is you still have a brain. Very funny guy. But the better news is I think we can fix it. So Peter recommended that I change medication. He said most of his patients had felt differently after taking this new med. So I did. So it was prescribed lamotrigine. Within a month, it was like someone took a black hood off my head and I could see again. That
Wow.
was 5 years ago. And since then, David, I've lost 40 pounds. I'm back actively in all the sports I loved and enjoyed growing up: skiing, tennis, golf, pickleball, hiking, snowshoeing, skating, hockey. All of it's come back and it's remarkable. And the
Sorry,
most
sorry,
important,
Gary. Pickleball isn't actually considered a sport, but carry on. Sorry.
correct. But if you're a tennis player like we are, it's a nice secondary activity when you're ailing. But we're with you. We consider tennis to be our primary sport. And the most important thing for me is I've always been a passionate person about life and about work. And the calmness that I now have is unbelievable. And my certainly my children have noticed, and my daughter's done a podcast about living with a father with epilepsy. But that's been the most extraordinary thing for me and for them, to have this new calm. As I said, I can still be passionate. I can still want to fight the fight. But I don't have those mood swings anymore, and it's wonderful. So that's an important part of our story and my story. And you know me, you know that I don't like to talk about myself. And so this has been a really hard part since 2010 to tell my story, because I realize how important it is for people to understand.
Hmm.
And there was one area that I think is really interesting, and that's the for those with intractable, it's a whole methodology of being human guinea pigs. Neurologists have data that says, hey, I can prescribe this medication based on this wide general public. And you may or may not fit that model. But there hasn't been personalized medicine yet. So Dr. Carlin, one of the projects he was working on that is still not done, but he was looking at using stem cell technology, skin graft, and creating 21 of your brains in 21 petri dishes, and then applying the med to each one of those brains, and then stimulating a seizure. Whichever medication prevented the seizure, that's your med. Fantastic, fantastic kind of research. And that would eliminate, because some people go through 4 or 5 different meds, cocktails of combination of meds. And so that's really, really hard on the body.
Well, and I know
Um,
that usually these you have to ramp up slowly, and if it's not working, ramp back down, and it's like you're like a human, like I think you said, a human laboratory experiment.
right. And that's hard on the body to do that, because you're on a chemical. You're on this chemical path, and then you got to come off the chemical, and then you got to go on a new one. And it can take a couple of years to find the right mix. And so that's a real hardship. But excited today, as I said, for me, it's been so great to meet all kinds of different people. I We take calls now at least once every 2 weeks from a family who's lost a loved one to SUDEP, and those are very special cases. But just for the audience today, March is National Epilepsy Awareness Month across Canada, and this is our month to campaign heavily to ask people to give some money to our cause to find a cure and find multiple cures for the different epilepsy types.
So, Gary, could I ask you when this call is over to put the website in the program notes, so if people want to donate or find out more, they can do that?
Absolutely. It's simple, pretty simple, www.epilepsy.ca.
Well, for those that have very short memories, we'll put that in the program notes anyhow. But I do have a couple of other questions. Like just in the last couple of days, they've talked about how the feds are going to, have national pharmacare, so they're going to be covering diabetes medicine and contraceptive medicine or meds and things like that. So, what I wonder when you're talking about, well, personalized medicine for sure, but in general, like what, how do the meds get covered? Like, what if, I
My
imagine
goodness,
if,
David, we've
sorry?
just uh, we've just lived through an experience with a new pharma distributed manufacturer in Canada called Paladin Labs. It's taken them 4 years. They have a new medication that works with those with intractable epilepsy. It's taken them 4 years to get their medication approved by Health Canada. Very long. And then it's going to take another year to have each province provincially approve it for their healthcare system. And then they had to go educate neurologists to their medication, and then finally to a patient. So it is anywhere from uh, 4 to 8 years to bring a new medication to the general public, which is extraordinary. You're
Well,
preventing people from having, an opportunity for a better life through that process.
and you think of how many people from SUDEP died that didn't have to in that time.
Correct. Correct. Yes. So we're working with a group right now. We're looking to fund. They're trying to create a detection tool, a risk assessment tool. So similar to breast cancer, you go through a screening process, and so this group in the United States is looking at, can we create a screening test for those with intractable epilepsy to see who's at risk. So beforehand, so that we can do something about those and for and with those patients so that they can reduce their risk of dying from epilepsy, which is a huge project that I'm really excited that we can support. But you're right, David. The I do feel badly for the pharma companies that takes so long, and that's why it's so expensive. It takes so long to get a medication approved, and then the work effort to go to each province and then go to the medical community to educate them on your solution, and then to the public. So tough job.
Wow. You talked about how there's in a lot of, I'm not sure of the right term here, but a lot of people that have SUDEP also have depression. So, is there any help for those to at least deal with the depression side of that while they're waiting? Because I'm sure that doesn't make things better.
Yeah, just we advocate and recommend that people find a neurologist that specializes in epilepsy. Those caregivers are treating epilepsy, but they're also providing advice and counsel as to how to deal with the depression side to them and their families. But then you're talking about other elements. So there are a lot of different comorbidities associated with epilepsy, the social stigma, the depression. Um, as I said, one of the things that hasn't been identified is how many we lose from epilepsy that had an accident, fell down the stairs, hit their head, because they had a seizure at the inappropriate moment. So it's always difficult. Um, no concrete solution today, David, but yes, it's a common problem.
Wow. Well, first of all, I really appreciate hearing more about your experience, and I think there's two things that our listeners can get from this, and one is that to learn more about epilepsy and the range of it, and some of the developments that are coming along, but all too slowly, but also the notion of taking control of your own condition, whatever it is, and find a way to
Correct.
contribute, because it's so easy to just sit back and say, poor me, I've got this. But to say, you know what, I'm going to do whatever I can. I'm going to do something about it. And that's a powerful message, whether it's about epilepsy or anything. And as you said, there's other, whether it's cancer or heart and stroke or things like that, there's always ways to contribute beyond just money, because a lot of people don't have the money, but there's other ways that they can contribute
Right.
to helping getting a stranglehold on some of these terrible diseases.
Well, David, that was really insightful for you to say, because my final message was going to be we all have to be our own healthcare advocate, and you nailed it. I learned that too long, too it took me too long to realize it, but once I did, that's been my important lesson is that, and I advise people every 2 years, there's changes, research is happening. Make sure you have a constant relationship with your medical team. And if you're not getting the right answers, go somewhere else. Um, Good message. Thank you so much for articulating that.
Well, thank you so much, Gary, and for reminding us that March is EPSA. I can't talk. I speak for a living, but not very well. Is Epilepsy Awareness Month. And there's always something we can do, whether it's just telling other people about it or contributing or stepping up locally as you've done so well nationally. So thank you so much. I've been here today with Gary Collins. Thank you so much for being with us, Gary, and providing some additional perspectives for our listeners that I hope they take to heart. And this has been David Guthrow with the latest episode of Discover Fresh Perspectives. Subscribe now, because on Fresh Perspectives, every episode is an opportunity to explore new horizons and redefine what's achievable.